Hi there. How would you like to live out the rest of your life not being fat, sick, and generally depressed? Well, the sad truth of the matter is that is where most of us end up heading and where we're going unless we take the appropriate steps to avoid this, to get off this path. And this is even more true when you have a thyroid condition because this just messes up your health. And I'm going to be teaching you more about your health than you probably learned from any doctor that you've been to over your entire life over the course of this DVD. Now, I'm going to share a little bit about who I am, what my credentials are, but why I'm so excited about the things I'm going to be sharing with you. But I'm going to also share a little bit about how we're getting the results that we're getting with our patients in our clinic here. Now, I can't go into a lot of detail because we would be here for days because there's a lot of very deep scientific stuff that we'll try to touch on some of them, but you're going to have to come in and experience these firsthand to find out what they're about. But I'm going to give you enough information here on this tape that you can decide, hey, does this guy make sense to me? Does what he says, have a ring of truth to it? And if it does, would I be willing to make these changes in my life so I can get my health, my youth, my life back? And if you are, I'm going to give you an incredible opportunity that will change your life. Now, I hear a lot of the times from patients that come in to see me says, listen, doc, I've been to my doctor before. We sat down and we went over my medications and or my symptoms, and so he ordered some lab work and put me on these medications. And then several months later, we sat down again, and I'm having the same symptoms, or even worse. So I said, Doc, I'm not doing any better. So he pulls out the paperwork and says, well, listen, Mary, the lab work shows that everything's normal now. So I know I'm giving you the right drugs. Maybe this is just all in your head. Now, if that's you, how does that make you feel? I don't know, maybe you've experienced this yourself. Now, if your spouse is along for the ride and he's sitting there listening to your doctor tell you these things, how's that supposed to make him feel? Because that's the only information that he's getting. So he starts to say things like, come on, hon, the doctor says there's nothing wrong with you. Come on, be like me. Get up, move, walk it off. It'll be okay, right? Well, whether you're watching this because you have a thyroid condition, or maybe you have diabetes, or cardiovascular disease, or whatever your condition, you're going to understand why our current healthcare system just does not handle chronic diseases appropriately. But you're going to understand, more importantly, what you can do to make it work for you. Now, I want you to understand right up front here that I'm not a medical doctor. I'm not an endocrinologist. I'm not a cardiologist or a gastroenterologist. I'm not a neurologist. I'm not a psychiatrist or psychologist. In fact, I received my doctorate in chiropractic care back in 1988. But my postgraduate education has been in functional medicine, functional neurology, the energy sciences, and I'm also a doctor of pastoral medicine. Now, what is that? Well, that just means that you have to become a member of the Pastoral Medical Association to be seen by me in my clinic here. And it's just a way of telling you that we're taking a different approach. It doesn't cost anything, by the way, but it tells you that we're going to be taking a different approach. It's one that's more in accordance with God's will for your life. So yes, I will be praying for you, for my patients here. I don't heal anyone. I don't have any supernatural powers here. In fact, I don't even treat disease. But that's not to say that we don't get the results for our patients that they're desiring when they come in to see me. Do I help people lose weight and balance out their hormones? Do I help people reverse their diabetes, recover from thyroid, autoimmune diseases, and even things like cancer? Well, yes, we do, because what we do is we look for the underlying cause of what a person's condition is by doing the appropriate lab work, and then we make the appropriate lifestyle changes, the dietary changes, balancing their energy out in their cells and stuff. And there's different ways we go about doing that. But I help to get my patients off their medications, avoid surgeries and amputations and all those other things that go along with these health problems, and we help them to get their life back so they can enjoy this healthy, abundant life that God truly intends for all of us to enjoy. Now, do you believe that you were put on this planet for a reason? I truly believe that we are. Every one of us has a purpose in this life. Now, do you personally feel that you have attained that purpose, that you fulfilled it, or are currently taking those steps to fulfill your purpose in life? Well, I don't know if you do or not, but I feel that I am doing that right now. I'm taking those steps to fulfill what God has put me here to do, and that's to help other people to regain their health, their lives back. But you know what? I couldn't even do that if I didn't have my own health. Because when you don't have your health, you can't hold down a job. You can't run a practice or a business. You can't get out and enjoy activities, the outdoors life, sports and recreation. Your relationships suffer. You can't enjoy your grandkids or your kids. You just can't enjoy life the way that God intended for you to. But as precious as our health is, so few of us do what it takes, taking the necessary measures to make sure that we protect it, that we don't lose it. Now, do you believe that we are in a healthcare crisis right now? Yes, I hope you do, because we definitely are. What is making us so sick? I mean, if you think about it, 1 out of 2 of us are going to die from heart disease. 1 out of 3 of us will develop diabetes in our lifetime. 40% of us now are developing cancer. 1 out of 3 women are clinically depressed. 1 out of 6 kids have a neurological problem. 1 out of 5 couples are unable to have kids now. 1 out of 8 women have an autoimmune or a thyroid disorder. 1 out of 8 people have an autoimmune disease. I think the numbers now have dropped down to 1 out of 5 women have a thyroid disorder. So, and these numbers are just getting worse every single year. Are we getting better or are we getting worse? We're getting worse, obviously. So what's making us so sick? And whenever I do my dinner talks, I like to have people raise their hands and participate in this. And some of the responses that I'll get, well, it's the food that we're eating. It's the toxins in the air, the EMF exposures. It's exposure to heavy metals like the mercuries that the dentists are putting in our teeth. It's digestive disorders. And they go on and on and on. But something that I always like to do is have them play a little game. And maybe you can do this at home. I want you to try to think of 2 things that you could do that will improve your health. 2 things that you could do to improve your health. Now, was one of those things take more medications? I don't think so. But yet, this is what we are being brainwashed into thinking. That if we take this little tiny purple pill, that the skies are going to be bluer, the grass is going to be greener, the birds are going to be singing, and life is going to be bliss. But I don't know, maybe you've taken that purple pill and found out that it's not all of life's answers, right? In fact, what it does is causes more problems. And if you continue to take that, that will cause you to have more symptoms that you're going to have to take other medications for. The fact is, anytime you take any medication that the doctor prescribes you without making the appropriate lifestyle changes, you're going to shut down your body's innate intelligence, this God-given ability that we have to recover from a disease and to keep it from becoming chronic in nature. That's right. And it happens with any type of medications. And so when you're dealing with a thyroid disorder, what you don't want to be doing is asking yourself, okay, what pill can I take to cover up this symptom or that symptom, to help me sleep better, to give me more energy? What you need to do is ask yourself, why did my thyroid stop functioning in the first place? So with a thyroid disorder, let's talk about how the thyroid actually works. And fibromyalgia is another symptom that usually goes hand in hand with thyroid disorders. Anytime you have fibromyalgia, you usually have a thyroid problem. First of all, where is the thyroid located? Most of us know it's in the front of our neck here. But the thyroid interacts with every cell in your body, and so it's going to affect everything from your bone metabolism, your immune system, your brain and nervous system, your endocrine system, your gastrointestinal function, your liver and gallbladder function, your growth and sex hormones, your fat burning, your insulin and glucose metabolism, your healthy cholesterol levels, and proper stomach acid. Now, if your thyroid becomes hypothyroid, your whole system starts to break down. You're going to see your whole health just start to fall apart. In fact, with hypothyroid symptoms, you're going to start to experience things like fatigue, weight gain, even if you're on a low-calorie diet, depression, constipation, oversensitivity to cold weather, cold hands, cold feet, muscle cramps, even when you're at rest. Poor circulation, especially noticeable in your hands and feet. Itchy, dry skin. stomach pain, gas, bloating, etc., dry, brittle hair and hair that falls out, edema. This can be anywhere in your body, but especially in your face, brain fog. And this can lead to things like depression, Parkinson's disease, Alzheimer's, a whole lot of other things. Have you ever experienced any of these symptoms? Now, let's talk about some hyperthyroid symptoms. If your thyroid is making too much thyroid hormones, you're going to experience things like heart palpitations, inward trembling, increased pulse rates, even if you're at rest, feelings of nervousness and emotional distress, insomnia, night sweats, and difficulty gaining weight. Now, are you or have you in the past been experiencing any of these symptoms? Now, did you say yes to both of those categories by any chance? If you did, then you're most likely not suffering from a thyroid disorder. This is from a condition called Hashimoto's. This is an autoimmune thyroid, and 80 to 90% of all thyroid sufferers actually have this problem. It's not a thyroid problem, it's an autoimmune disease. Now, let's talk about a little bit how the thyroid pathway works so you'll understand some of the things I'm going to talk about later on. This all starts with a little gland in your brain called the hypothalamus. Now, the hypothalamus secretes a hormone called TRH, thyroid releasing hormone, and that communicates to with another supergland called the pituitary. The pituitary then will release a hormone called thyroid stimulating hormone, or TSH. You may be familiar with this one. Now, TSH will go and mix with the thyroid and cause it to secrete enzymes called thyroid peroxidase, and then this will start to make two different types of thyroid hormone. One is called T4, and it's because 4 iodines attached to it, and then there's another one called T3, and this one only has 3 iodines attached to it. Now, 93% of the thyroid hormone that you make is T4, and this is essentially inactive. It doesn't have the metabolic effects on your cells that you want it to, or the T3 does have this. The problem with that is that the T4 tells the doctor that the levels are up, but it doesn't tell you how much of the T4 has been converted to the T3. So even though your gas tank can show that it's full, and the hypothalamus then tells the thyroid to not make any more hormone, it can still not be making enough T3. So you're going to have all the hypothyroid symptoms, the hypothyroid functions. So what has to happen is the thyroid hormone will enter into the circulation, and it's going to travel to different glands. And it's going to, first of all, it attaches to little protein-bound carriers called thyroid binding globulins, along with other ones, and it's going to travel to places like your liver and your kidney, or your stomach, and your different peripheral tissues. Well, the liver is where 60% of this conversion takes place from the T4 to the T3. The stomach is where another 20% takes place. Now, once it reaches there, that bound protein lets go of the thyroid hormone, so then it becomes unbound. That's what we call free T4 and pre-T3. So the free T4 then is converted to free T3. This re-enters in your circulation, and is carried to the different cells from your blood vessels, and then this enters into the thyroid receptors and interacts with the cell's DNA. So the secret to having thyroid functioning properly is getting just the right amount of thyroid hormone, not too much and not too little. Now, the medical profession has been dealing over the past 50 plus years treating thyroid disorders the same way. What they do is give you thyroid medications. So there are 3 different types of thyroid medications that they can put you on. One is just a plain T4, and these are things like your Synthroid or levothyroxine. They don't have any T3. Now, they also have other medications that have both T4 and T3 in it, and those are things like your Cytomel or Armour. Those are 2 very common types. And they also have a third category, which are your bioidentical hormones, and these are things like your Cytomel, or not Cytomel, but your Nature's-Throid, West-Throid, and those are ground up glandulars of other animals. But the bottom line is all these do is provide the thyroid hormone that your thyroid is supposed to be making. So when it provides a hormone that your thyroid is supposed to be making, that causes your thyroid to stop making its own. So it just essentially lays down and dies. So if they've been putting you on thyroid medication for many, many years, your thyroid will shrivel up and actually lose function. It may still be reversible. We don't know. We have to run the test and stimulate it to see if we can get this happening again. But the bottom line is they're going to shut it down. Now, you may have experienced a brief, what we call the thyroid hormone honeymoon, when you first took that thyroid hormone, but then it starts to lose its effectiveness. And most of the patients tell me that they just don't feel a difference. And if you are, again, having a thyroid issue or an autoimmune condition, that's not the thyroid problem, that's your immune system, and that's what we call Hashimoto's. Now, another problem is that a lot of you have been told that your tests are normal, and the reason for that is most of the tests that they run are really unreliable. And what they're doing is actually taking everybody that's been over to the clinic in the past year and plotting them on a bell-shaped curve. And the people that are in the outer 2.5% get labeled as high or low, and everybody else is considered normal that's in between that. Well, we know for a fact that 95% of the population is not healthy, right? 95% of the problem of the population doesn't even not have thyroid disorders. We know that between 1 out of 5 and 1 out of 8 women have a thyroid disorder. Now, these numbers are going to vary from city to city as well. But what they're doing is taking a look at those outer 2.5%, and they're not optimal ranges. What we do is we take a look at the functional values, the functional ranges, because these are much more sensitive, and we're going to be able to detect problems before they require a complete replacement of your own thyroid hormone. Now, let's take a look at some normal values of some lab work that was done on a patient, and these we're going to compare with the traditional values versus the functional values. Now, the first one we take a look at is glucose. If this glucose was coming in at 73 within the traditional ranges, that tells us that's perfectly normal. But to a functional doctor, when we take a look at that, that tells us that this patient is hypoglycemic. They're not getting enough glucose into their cells. TSH being at 4.2, that the medical doctor says, hey, this is normal. But to a functional medicine doctor, this tells us, no, this is hypothyroid. Triglycerides, if they're coming in at 149, normal for the medical doctor. 149 tells us that's insulin resistant. And hemoglobin at 13, that's normal for the conventional, traditional values, but again, this tells us that a patient is anemic. The problem is that the conventional medicine just doesn't diagnose subclinical presentations. You have to be really sick or you're not sick at all. There's no in between. Another problem is the types of tests that the doctors order. They order the minimal amount of tests so they can get the minimal results, so they can give you the minimal treatment. So this is done at a minimal cost. But who ends up paying for it in the end? You do. That's right. See, a complete functional thyroid test is going to include things like not only your TSH and your T4, but it's going to include your free thyroxine index, your free T4, your free T3, your reverse T3, which is telling us that there's too much thyroid being made, so the hormone, so it puts on the brakes. So that's what reverse T3 does, so you don't overstimulate and give yourself a heart attack. It's going to give you the total T3 on T3 uptake. This is what tells us how much thyroid hormone is actually being taken into the cells. Don't you think that would be kind of important to know? And then there's the thyroid antibodies. Your TSH is checked for your Graves' disease, and TPO and TBG is going to be checked for Hashimoto's. And again, these are not thyroid disorders. These are autoimmune problems. Now, why would your immune system start to attack your own thyroid? Let's talk about a few of these conditions that this would happen under. First of all, dysglycemia. This is an abnormal regulation of your serum glucose. This can come from eating too much sugar. This can come from other organs malfunctioning, because not only does your pancreas help to control your glucose, your liver, your adrenal glands, your thyroid, and even a little bit of your digestive system, your gut, will all contribute to keeping your glucose regulated. But if these get out of balance, that can cause a stress to the thyroid and to your immune system, and it'll start attacking your thyroid. Another problem is with your adrenal glands. Now, are you exposed to stress? Well, most of us are. Now, there's a healthy amount of stress, but there's also an unhealthy amount of stress that we can start to be exposed to on a daily basis. Now, your autonomic nervous system, I'm not sure if you understand the different parts of your nervous system. You have your central nervous system, and it's broken down into two parts. One's called the somatic nervous system, and these are the nerves that you control things with. It allows you to move your hands and your feet and your body. It also allows you to receive the input of the sensations, your touch, your burning, your hot, your smell, your sight, your vision. All of these things come from the somatic nervous system. But the autonomic nervous system is the part that works automatically. You have no control over it. It just happens automatically. So your digestion of your food, your growing of your hair, your making your hormones, all these things you don't have to think about. They just happen automatically. Now there's two different parts to the autonomic nervous system. One is the parasympathetic and the other is the sympathetic. Now the parasympathetic part is the part that regenerates. It heals, it grows, it's your immune system. It helps keep you nice and healthy. Now this is kind of like the gas pedal on your car. It helps to make the car go. Now the brake is the other side of the coin here. This is your sympathetic nervous system. Now this is what causes your fight or flight response. So anytime you're exposed to something that's life-threatening, this is the part of your immune system or your parasympathetic system that kicks in, and it shuts down your parasympathetic system. Now this is okay if this is only happening, a couple times a year or maybe even once a month, because this is, when something happens that you have to run away or you have to be prepared to fight or do whatever to save your life. Now, most of us, unfortunately, are exposed to this type of stress on an ongoing basis throughout the day. Now, what this does is shuts down the parasympathetic system, so you're going to get sick. You're not going to be able to fight disease off. So how do we handle that? Well, there are certain techniques that we teach our patients on being able to get to those, but more importantly, there are going to be stresses way back in your younger years that are going to be triggered by certain events because they're contained in cellular memories, and not just your brain, throughout your entire body. And the studies are showing that this to be the case. In fact, you may have heard of some people where they have transplants, and they'll have somebody else's kidney or a liver or whatever, and all of a sudden they'll start to have cravings of what their donor had before. They might have cravings for sugars or sweets, or maybe start to have desires for going somewhere, having relations with someone else. I mean, it's crazy what they've done. In fact, one of the studies they did, a reported documented case, was where somebody called the police station. They woke up in the middle of the night and said, I'm a recipient of a replacement. I was of another donor, and I was murdered. And I'm going to give you the details of it. And he described every detail of the murder, things that had not been disclosed to the public, and that the police actually went to that person's house, arrested him, and they convicted him of the murder. You see, it's not just the memories that are held in our brain, but in all these other cells. And there are certain triggers that can cause this to fire off. And the more emotional that event was, the more emotional that trigger is going to be. And it can actually cause you to become unhealthy. So we're going to help you to reset those memories and to heal those memories. And it's not by going back and bringing up these old memories and trying to cope with them and all the stuff that the psychiatrists and psychologists do. We have other things that we call field control therapy and dealing with the memories. We're going to actually get in and help your cells to detox and turn those around. But we've got to get your adrenals repaired. Now, I can't control the amount of stress that's coming from the outside, but we're going to help you to be able to handle it better, and more importantly, we're going to be able to rebuild your adrenal glands if we need to, so they'll be able to withstand some of these forces on the outside and to keep your immune system from going crazy and starting to attack its own system. Another problem can be hormone imbalances. Now, what is going to throw our hormones out of balances? Well, stress, that's one of them, of course, and there are a lot of different things that can cause your hormones to be out of balance. But one of the common things that I see is things like skipping breakfast. You see, when you skip breakfast, what happens is that during the nighttime, your adrenals start to make a hormone called cortisol. And this gives your liver and your pancreas the night off so they don't have to work so hard. And then it makes this cortisol that helps to regulate your glucose through the night. Well, when you get up in the morning and you skip breakfast, now your adrenals have to keep going. They're ready for a break, but they have to make this cortisol, which is a fat storing hormone, by the way, and your pancreas and your liver don't get the exercise and the function that they need. So your adrenals start to fatigue and they start to burn out. So again, these are going to throw your hormones out of balance and can cause your immune system to start going crazy. Other things it can be are neurological imbalances. Now, the neurological imbalances, we know from, neurologists, chiropractors, orthopedists, even the medical doctors, they all know that the brain contains all the information how the body's supposed to function up here. Then this information travels down the spinal cord, out through the nerves to all the different tissues in the body to tell it how it's supposed to thrive, to heal, and to do the things that it's supposed to. Now, if there's any interference with those nerves along the way, and that's most likely going to happen at the levels of the spine because the nerves exit between each vertebral segment, and there's a disc that's in between each vertebra with the next vertebra, and that's what keeps the space open so the nerves can exit and go to different tissues. Well, if you have an injury, if you get in an automobile accident, if you fall down, hurt yourself, that can cause these vertebrae to be damaged, and they start to alter the mechanics, and that will start to wear the disc down, cause inflammation, cause pressure on the nerves, and then those tissues will start to struggle and to not be as healthy as they can be. But there's also another thing that can happen. There's a very close relationship between the brain and the gut. In fact, a lot of the doctors refer to the gut as our second brain. In fact, when one of these tissues starts to break down, the other is going to follow suit. In fact, one of the studies that they did, they took some little rats and they bonked them on the head to induce these traumatic brain injuries. And what they found is after they did this, within 6 hours' time, every one of the rats developed a leaky gut, showing that there's a connection between the brain and the gut. So if you've ever had a traumatic brain concussion, anything like that, you most likely have at least one time, or maybe ongoing, have a leaky gut. So what's a leaky gut? Well, a leaky gut, your small intestines have this little microvilli, these little brush borders that kind of opens up and breathes like this. So whenever you digest your food, if the food passes from your stomach into the small intestines, then your intestine starts to break it down. The proteins to the amino acids, your carbohydrates to the glucose, and your fats to the fatty acids. Then these tiny microscopic molecules can get through these little brush borders into your blood and is carried to the rest of your body to provide the nutrition that it needs. Well, with a leaky gut, what happens is these little gates will stay open like elevator doors that are stuck. Or in an autoimmune disease, it'll actually start to eat away at those microvilli, so it's like having bare knuckles. So now all these undigested food particles, bacteria, parasites, who knows what else is getting directly into the blood, then that's carried throughout the body and it starts to cause damage to the tissues. Then your immune system sees that and starts to attack it. When this is ongoing, your immune system becomes very ferocious and it starts to take out innocent bystanders. So if this turns on your thyroid, then that turns into Hashimoto's disease. If it attacks the cartilage in your joints, that turns into rheumatoid arthritis. If it attacks your brain, that can turn into Parkinson's or Alzheimer's disease. So very important that we make sure that the gut has been repaired, because we need to hold all your food inside while it digests it, as well as all the bacteria and the parasites and everything else. But then the other side of the coin is also true. In fact, one of the studies that they've shown was that on people that had died over 65 years of age, when they did an autopsy on them, what they found is 1 out of 3 of them had some degree of degeneration associated with Alzheimer's the disease that had contributed or actually caused the death of the patient. 1 out of 3. You see, when the stomach lining breaks down, all those chemicals, all the toxins, all the heavy metals get into it, and then that starts to break down the blood-brain barrier. Then those toxins get into the brain, start to cause neuroinflammation and all sorts of problems. And anytime you have a leaky gut, that doesn't mean you're going to have symptoms like gas and bloating and stomach aches and pains, but you can have neurological symptoms. You can start to have skin disorders, psoriasis, eczema. You can start to have things like brain fog, memory loss, headaches. The neurological symptoms are actually more prominent than the digestive issues when you have the leaky gut. So that's definitely one of the things we need to take a look at. So how do you know which one of these things is going on, causing your immune system dysfunction? Well, you have to do the proper testing, and that's what we do in our office here. Other things that can cause this are things like active antigens. So this can come from chronic infections. Now, for those of you that are struggling from fibromyalgia, one of the things that we found with our patients is that a large amount of, probably over 90% of them, are actually due to a bacteria that gets in called Lyme disease. And we used to think that Lyme disease was caused by tick bites, but with 200,000 to 300,000 new cases being diagnosed every year, we're starting to think, oh no, this is coming from somewhere else. We're starting to suspect that it might be coming from mosquito bites or from some other type of fluid exchanges. But this is becoming very prominent. It's like an epidemic. So the difference between Lyme disease and fibromyalgia are so difficult to diagnose. You have to make sure you're running the proper test. And if they've already ran the blood work on you to rule out Lyme disease, that doesn't mean anything, because in 50% of the cases you get a false negative, and this can go on again and again and again. Now, many people go undiagnosed with Lyme disease, and they're still trying to cover it up with all the medications, like Lyrica and all the other things for fibromyalgia, when we need to get to check the immune system out. And we have ways of doing that in our office that are really outside the box, but we will definitely find those. Other problems can be parasites, because again, parasites are not supposed to be there, so your immune system sees that as the enemy, starts to attack them. If this is ongoing, it starts to turn on your own tissue. And then there's things like food sensitivity, like gluten. Do you think gluten is just another fad diet, or is there really something to this that's affecting your health? Well, let me reassure you, this is a definite problem. Well, what is gluten? Gluten is actually a protein that's called gliadin, the scientific term for that. And there's actually 12 different isotopes of it. And so if you've been tested for gluten sensitivity, you most likely got tested for one of those. If one of them came back negative, you still have another 11 that they most likely did not test for. And there's only one company that I know of that does this. This is through a company called Cyrex that tests for all different 12 isotopes to see how it's affecting your immune system. And it turns out that 82% of Americans have some degree of gluten sensitivity. So again, what is gluten? Well, gluten is a protein that's made by plants like your wheat, your barley, your spelt, your rye, kamut. And what this does is it's kind of a distractor or a deterrent for animals so they don't come and eat it all up, because it messes up their digestion. Well, guess what? It messes up ours as well. Now, I know some of you may be thinking, okay, wait a minute, Jesus ate bread and all of his disciples and they didn't have any problems. Well, the bread and the wheat was different back in those days. We've modified our wheat. What used to contain 28% protein now only contains 11%, because all of our food corporations, they said, we like this gluten stuff. It gives our food a better texture. It makes it taste better. And so we want you to come up with some hybrids for those wheat. So that's what they did. But they don't stop there. They add gluten to all the products, all your pastas and your breads and your sauces. So we have this huge amount of gluten, and this causes many of us to become hypersensitive to it. And it can actually cause the microvilli to start breaking down in the small intestines, and itself causing the leaky gut. So yes, gluten is definitely a big problem. Other things are like environmental toxins. You realize we're exposed to over 60,000 toxins today that we weren't just 40 years ago? That's right, and we're absorbing this through our skin, we're breathing it in through our lungs, we're ingesting it through our foods and our drinks, and this starts to build up in our system. Now, your detoxification organ is Your liver, right? Now your liver can only detoxify so much. And if you haven't been detoxifying your liver, it's like driving the car around all your life without ever changing the oil filter. You've got to clean out that liver and the gallbladder and the gut too, because it's just so filled with all the toxins. Your stomach is most likely lined with all this slime and all the bad bacteria. You're supposed to have some bacteria in your gut, about 4 pounds of it, but it's the good bacteria that breaks your food down and makes your vitamins. It helps you digest and absorb your food. If you have all this slime in your gut, you can be living in the Garden of Eden and not being able to absorb your nutrition the way you're supposed to. So you're going to be malnourished. Now another problem can be from undigested food or the wrong kinds of food. Now there's a problem that we had to kind of introduce back in the 1990s called genetically modified organisms. What they've done is they've taken our food supply, a lot of them, and they started to splice the DNA with other things. For example, they take the corn and they splice the DNA with insecticide. So now the corn makes its own insecticide. So the bugs come along and munch on it, punches holes in their digestive tract, and they die. Now, what do you think happens when we eat it? Very similar circumstances here. Yes, it's going to cause leaky gut, but more importantly, this is going to cause genetic mutations. In fact, a lot of the pediatricians are warning you now, if you're considering getting pregnant, you need to be off GMO foods for at least 2 weeks before conceiving, because this will cause genetic mutations in the kids, and it's causing all these food sensitivities. They're coming out with increased autism, neurological condition. We are just beginning to tap into all the damage that this stuff is doing to our system, to our food. So, and there are certain foods that you just have to go organic with, and you don't want to be eating those GMO foods. Very, very bad for you. Another problem is heavy metals. We have a lot of heavy metals that are being absorbed through the mercury, through the different fish. If you have dental fillings that contain mercury, guess what? Those are leaching into your system. They're causing infections. In fact, 97% of the people that die from terminal cancer have had root canals. That's right, they've had root canals, and then they've had the mercury filling so the bacteria can get in there, and then the mercury gets in there and it causes problems with your immune system. It causes other issues. And we're still doing studies on this, but we know that there's definite toxicity in mercury, and a lot of the times we have to get this out of our patient's mouth. But we do the testing in our office to find out if the heavy metal burden is actually problems for them, because all of us have, most of us anyway, have these mercury fillings. All of us have some degree of these heavy metals that have accumulated in our bodies, but it doesn't affect us all the way. So we have ways of testing to find out how it's affecting your cells, if it's a burden to them, and if they're going to need to be taken out. But we don't do the chelation therapy in here because that can be very dangerous. Chelation therapy doesn't ensure that you're getting rid of the metals that you're having pulled out. It just means it's being pulled out of the tissues, but then it's put into circulation. If you do that, then those heavy metals can actually take up residence in things like your kidneys and your brain and do permanent damage to them. So getting rid of heavy metals is a very precise technique that you have to do it, and you have to do it very carefully so you don't cause damage to yourself. So again, how do we know if these are problems for you and causing issues with your immune system? We have to do the proper testing. Now, what we do for our patients is we construct what we call a curriculum for them. And there's 5 different pillars of health that we need to address. We've already talked about some of these. Detoxification. Yes, we have to detoxify the liver, the gallbladder, and the gut. And by the way, if you have a thyroid issue, you have a 9-fold increased risk for having your gallbladder removed. Now, if you've already had your gallbladder removed, that's most likely a big hint that you may have a thyroid issue or thyroid problem going on. The next thing we want to do is teach you about nutrition. Now, just learning how to eat right isn't enough. You have to learn what not to eat. Those GMO foods, you have to learn the right nutrition. Do you think you need vitamins? Well, absolutely. Do you realize that you'd have to eat 50 peaches today to get the same amount of a vitamin A out of a peach that you ate back in the 1920s? because our soil has been depleted of all of the nutrition, of all of the minerals, everything that we need to keep our bodies healthy. So you need a good organic, plant-based type of nutrition that your body can recognize as food and absorb it and use it. Now, I don't know if you read about any of the studies that have been coming out here. And they recently went into Walmart and Target and pulled their supplements, their nutritional supplements off the shelf and run the tests on them. What they found was that 80% of them didn't even contain the nutrients, the herbs and everything that they were claiming that they had in them. Another study back in 1996 went into a health food store. I mean, the good stuff, a health food store. And they wanted to find out if the nutrients and the nutritional supplements were toxic, effective, or both. And what they found, out of 196 of the products that they tested, only 5 of them passed the mustard and either were non-toxic and effective, or both. Only 5 out of 196. So what's wrong with the other ones? Well, most of them are synthetic. They don't have the real vitamins and the nutrients in them. So when you get that vitamin C that says 500 milligrams, you can rest assured that's synthetic, because vitamin C is not found in nature in those doses. What it is ascorbic acid. That's like eating the shell of an egg and thinking you're getting a whole egg. It doesn't have all the coenzymes, the cofactors, everything you need to break that down and utilize it. You know what they make synthetic vitamin B out of? Coal tar. Coal tar is not good for us. We don't want to be ingesting petroleum products. And yes, this will start to, clog up, the liver and cause, toxic effects throughout our body. So yes, we have to teach our patients about not only the right nutrition, the foods to eat, but we have to teach them about the kind of vitamins that they're going to need to be taking as well. The next thing we need to do is address fitness. Do you have to exercise to feel good, to be healthy? Absolutely. But what if I told you you only need to work out 2 to 3 times a week, 30 to 45 minutes a session to stay in shape and to have your health be optimal? That's all it takes. It's not about going into the gym 5-6 days a week and getting on that treadmill or the bicycle and spending 45 minutes to an hour or another half hour working out with training. That can actually increase your cortisol levels, because cortisol is a fat-storing hormone. You can find that you're just spinning your wheels and not be able to lose weight. But here's the secret. Here's the secret. You need to put on muscle mass. In fact, for every pound of muscle that we put on you, we're going to increase your body's metabolism by about 1,500 calories per month. So if we can put 4 or 5 pounds of muscle on you, you're not going to have any problem maintaining your weight. Yeah, we do help you to lose the weight, but without exercise, no diet program is ever going to be permanent and successful. You have to include exercise in it. So exercise is very important. It not only gets more oxygen and glucose into all your tissues, to your brain, it combats depression. It helps to regulate your glucose. It combats insulin resistance and diabetes. So many benefits to exercise. The next thing we want to do is address hormones. Do you realize that between 75 and 80% of all diseases are due to hormone imbalances? That's right, and thyroid hormone is a hormone, right? So we have to make sure all those hormones are working together and making sure the endocrine glands are functioning the way they're supposed to. The next thing we want to do is address the nervous system. Now, the nervous system is contained up here in the brain, right? We talked about that before. All the messages come down here, but there's that brain and the gut connection. So we have to make sure that neither of them are leaking, that both of them are communicating with one another, and that everything's functioning properly. Now, if we were to put a curriculum like this together for you, which one of these pillars of health would you want to leave out? None of them, right? Because if you left out any one of them, you could be leaving out the one that's most crucial to you, to your health. So we have to address all of these. Now, here's the way we do things at Abundant Life Health and Wellness. You can't come into our clinic and write us a check and say, here you go, make me better. What we'll do is partner up with you. We'll show you how to run these tests or send you out to run the tests. We're going to do the testing in our office. We're going to show you how to get on the right nutrients, help you construct your diet, balance out your immune system, do whatever. but you're going to have to be the one that takes responsibility for that. You're the one that's going to have to exercise. You're the one that's going to have to make sure you're eating the right foods and taking the right nutritional supplements. I know some of you may have been through other weight loss protocols before, programs, or maybe thyroid programs, and maybe you just didn't get the results that you were hoping for. Well, you have to ask yourself, did they teach you about nutrition? Not only the good foods and the bad foods to avoid, but did they teach you about the vitamins, the right kind of vitamins to be taking? Did they teach you about fitness, the proper way to exercise, and show you how to develop those muscles quickly and effectively so you can get the maximum benefit and not be wasting all that time in the gym? Did they teach you about your hormones, how to run and test for them, and if they're out of balance, how to get them back into the balanced way they're supposed to be, and how to bring the endocrine glands up to the functioning levels that they're supposed to be at. Sometimes you completely need to rebuild an endocrine gland, which is completely possible. It's something the medical profession, again, isn't telling you because it's done with nutritional supplements. The next thing you want to do is address the nervous system. Did they address the gut, the brain, the spinal cord, make sure everything is functioning the way it's supposed to? And finally, did they detoxify you, get that liver and the gut and the gallbladder cleaned out and functioning the way it's supposed to? Because if they didn't do all these things, most likely that's part of their problem. And the next thing, did they have a system? You see, 94% of all failure is due to not having a system. With our program, there is an ABC approach. We start you off, we take you through one step at a time, we take you by the hand, we make it very easy and very attainable for you. We're going to make sure that you do these and don't miss any steps. The next question you have to ask yourself is, did they provide a mentor? Did you have somebody that was down in the trenches, rolling up their sleeves, doing and practicing the things that they were preaching? I'm an autoimmune patient myself, so I know what it's like to have to eat the foods and how to balance your diet out. Yes, I like to eat, but you know what? You don't have to eat the garbage that they've provided for us that they're calling our food supply today. You can replace those with healthy things that taste just as good. It's so much easier today to live on a paleo-type diet, an autoimmune diet, on a gluten-free diet than it was, just even 10 years ago, because they've made it so much easier. There's so many more people that are involved in this, so many more products that you can buy, and we're going to help you to find those, show you where you can purchase them, how you can plan your meals out and make it very, very effective. Now see, this is the way we do it for all of our patients. We put all these things together and provide a curriculum for it, but everybody's different. So we have to find out what are the specific details of your life that we have to address so we can address each one of those. So yes, you have that curriculum, but then we have the very things that are very specific to you. Now, if you wanted to learn to fly an airplane, could you do it from reading a book? Probably not. Huh? Not too many people would want to fly with you if you did. So you might have to attend a class or 2 or 3 or 4, right? And you think you might have to touch an airplane, even get in the airplane, sit in the cockpit. Yeah, and then when you're ready to take off for the flight, your first flight, who do you want sitting next to you? You want your instructor, your mentor, somebody that knows the ropes, because if you run into problems, they're going to be able to show you how to handle them, how to get out of those problems. And that's what we do with our patients. We mentor them. We take them through all these things to help them to attain the healthiest life that they possibly can. Now, there's a Chinese saying that says, tell me and I may remember. Show me and I will remember. Involve me and I will understand. Now, of all the things that you've learned by watching this DVD here, what's the most important thing that you need to remember? Well, let me give you a clue. It's found in that word, involve. You see, if you don't put these things into practice, you're going to forget about them. In fact, most people only retain about 7% of the information that they hear 48 hours from when they have heard it. Those aren't very good odds, right? Very good numbers. But if you start to implement those numbers are going to improve drastically. But there is an ugly monster that's ready to pounce on you and stop you from putting any of these into practice, from doing anything that's going to better your health, and that is procrastination. See, procrastination is our health's worst enemy. It's our biggest enemy, because we always think, okay, I'll get around to doing it tomorrow, or I'm going to save up to do this, in the future, or I'm going to put this off and wait for somebody else to do it along with me. You can come up with who knows how many excuses, but the bottom line is you have to take responsibility for your health. It's not the government's responsibility. It's not your insurance carrier's responsibility. It's not your spouse's responsibility or your kid's responsibility. It's your responsibility to take care of yourself. And the longer you wait, the worse your health becomes, and the more work that's going to have to be done to get this turned around. So what do you have to do to start to revert this? Well, the first thing we need you to do is fill out the paperwork. And I bring this up because there's a lot of it. There's more paperwork than what you're most likely used to doing when you go in to see your traditional doctor. But I need all this information because this is what's going to help me to develop a curriculum that's specific to you. I need to know how long you've been sick, what kind of surgeries you've had, what type of medications you've been on, how did they affect you, what kind of nutritional supplements you are, what's your diet like. I'm going to take all this stuff together to put a curriculum that's very specific to you so that I don't have to do an overkill or an underkill, but just the right amount of treatments or recommendations that it's going to take for you to get your health back. Now, what is the cost involved for this? Well, to help you to understand the value of what I'm going to share with you right now, what does it cost you to go see your medical doctor? Most people don't even know because their insurance takes care of it. And it's not the copay, right? It's not the copay and it's not the deductible. It's what you're paying into your premiums. And they've kind of buried those numbers so you have no clue to what you're paying for your health care. But for the average doctor in this area, it can range anywhere from it's $100, $150, $200. If you're seeing a specialist, like you're going to be seeing me here, it can be up to $500, $750, $1,000, $1,500. Just depends on which specialist you're seeing. Now, when you get in to see your doctor, how long do you have to wait in that waiting room before you get to see him? Yeah, that's another story. Sometimes 30, 45 minutes, and then when you finally get in to see him, how much time does he spend with you? I think the average is 5, 7 minutes or so. Now, if every time you went in to see your doctor, you had to wait 45 minutes to get in to see him, then he spent 5 to 7 minutes with you, you had to pull out your wallet and pay out $150, $200 just for them to give you some more medications or hormones that you're not feeling any better taking and you're only getting worse, would you continue to do that? Well, if the answer is no, may I suggest that you're not perceiving that there's an equal exchange of value there, right? Now, how much time should I spend with you? Well, how much time have we already spent together on this DVD here? Well, see, you have been pre-educated. I don't have to teach you these things now. You are going to come in to see me already knowing this, so now we can get down to the brass tacks that are specific to you. I'm going to set aside an hour for you, so if you've done your paperwork properly, that's going to be sufficient. It's going to be all the time that we need. Sometimes it goes a little bit longer than that there, but usually that's sufficient for doing that. Now, is it fair that I charge a fee for my services? Because we do. Yes, we have to keep the doors open in here. And if you come in, what we're going to do is provide a complete consultation in history. And this is where we sit down, we talk about all the paperwork, and then we're going to go into that much more in depth. We're going to do a neurological and wellness examination. Now, what's a neurological examination? I'm going to take a look at your brain, your cerebellum, your peripheral nerves to see how those are functioning. Because if you're dealing with a thyroid disorder, most likely this has started to affect you neurologically, and I want to find out how much damage has been incurred. I also want to take a look at you metabolically. I want to see how your thyroid is doing. I want to see how your adrenal glands are doing, how your digestive system is functioning. I want to see how your hydrochloric acid is doing. I want to see if you're absorbing your minerals in your food. We're going to be able to tell that on this examination. And then we're going to do a report and a plan of action. Now, this is where we sit down and show you what type of a curriculum you're going to need to be on. Now, we charge $295 for this evaluation. Now, if you've gone to a specialist before, like I said, this is going to probably be about a half of the price you would normally pay to a specialist, up to sometimes several times fold, because you're dealing with someone that's put in a lot of extra hours besides the normal training like I have, so we can get to the root of your problem and make these corrections. Now, let's get back to that old procrastination monster. He is going to try to rob this from you. He's going to keep you from making any decisions, about keep you from calling to make an appointment in here. So what we're going to do is try to nip this guy in the bud. So the way we're going to do that, if you call within the next 7 days, we're going to give you this examination for $95. If you wait more than a week, you're going to forget about it because it's just going to be in the back of your mind and it's just going to dwindle away and it's just going to be an old afterthought. Trust me on this. If you're serious about your health, if you're wanting to get your health back, pick up the phone or contact us through email. We'll send you all your paperwork so you can start filling this out and you can give us all the information that we need to so we can get started on this examination. Now, is $95 going to cover my time? No, it's not. So why do we even charge it? Well, $95, first of all, I don't want to set a financial barrier that might prevent you from coming into what could be the most important appointment of your entire life. But what this is also doing is telling me that you're getting serious about this. You're ready to start investing in your own health. You're ready to get some skin in the game. So yes, we do want to charge a fee because this, I'm telling you, you have to take responsibility for your health. Your insurance is not going to do it. They'll give you pain medications or whatever medications you need, provide surgeries, but when it comes to reversing your health, getting it back on track, you're going to have to be responsible for that. And the one thing I do ask, though, is please bring your spouse with you. Now, why would I care if you brought your spouse? Well, first of all, I want your support team there. I want your spouse to see how sick you are or aren't, or your significant other, because most likely they have no clue. And when we put you through this examination and I start to explain these things, the lights are going to come on. And they're going to be a lot more supportive than what they've been in the past if you have one of those types of spouses. Hopefully you do have somebody to support you and believe you, the things that you're saying. But if not, we're going to help to educate him. The other thing is we're going to have 2 sets of ears, 2 sets of eyes. What I found is just impossible for you to come to this appointment here and to go back and effectively explain that to your spouse or significant other. You're not going to remember. You're not going to retain even half of that information. Now, if you're like me and my spouse, we like to talk about our financial investments as well. In fact, when we first got married, we decided we weren't going to spend over $25 without consulting the other person first. And that's kept us out of a lot of financial arguments. So if you need to talk to your spouse about the finances and stuff, you need to have them there for this appointment here. So I want them to be there to support you. Now, if you're getting ready to boot your spouse out of the house and they're not supportive, or if you make your own financial decisions, that's another story. But I just want to make sure that you come prepared because this is going to change your life, and I want you to have every opportunity to do that. Please be on time for this appointment. Come with your paperwork filled out. If you come with it not filled out, it's going to take 45 minutes to an hour at least, and we're going to be rushing through this, and you're not going to get the accurate examination that you need, that you're paying for. So please show up on time. I don't like to keep my patients waiting, so if you show up on time, I'm going to be there for you. Very rarely that I have to have a patient waiting, and I like to keep it that way. So please be on time. Now, these programs are not for everyone. Therefore, are serious students. In fact, we are looking for what we call the A and B students. An A student is the one that says, okay, doc, I get it. This medical system is not working for me. Show me what to do. I'll do it. The B students, the same way, it's just that they're not as disciplined, so they tend to fall off the wagon. We help them get back on. We can work with that. In fact, most of our patients are in that scenario here. The C students are the ones that are always dragging their feet. I need to think about it. I need to talk to this person, or I need to wait a while, or get these things in order, or it's not that we don't want the C students. It's just that their health is not a priority, and your health has to be a priority if you're going to go through this program, because we are going to change your life, and you have to be motivated enough to follow the instructions and do the things that we're going to be teaching you about this. Now, some of the questions that I get here, very common ones, as one, will my insurance pay for this? Well, it's not that we don't take insurance. It's that the insurance doesn't pay for well care. Yeah, they'll pay for sick care if you want the medications or the surgery, and they pay for diagnostics. And yes, we do use diagnostics. We do a lot of lab work. So if your insurance pays for that, we most likely will be able to use them. If they don't, we're going to do the lab work at my costs. We're not going to be doing it at what you may have to pay through the insurance carrier, through other companies. Sometimes, $2,000, $3,000, $4,000 worth of lab work. We're going to get these things done at minimal cost for you here, and we'll pass those savings on to you. I don't make my money by doing lab work, okay? That's going to be done at my cost. Then we're going to make sure that we can get to the underlying cause and start to get your problem corrected. Other questions that I get is, what do your programs run? Now this can vary tremendously because you may have just started to develop some symptoms. You may be a thyroid patient. Your thyroid could be destroyed. You may have been on thyroid medications all your life. Those are two opposite extremes. Now, if you can afford, say $130, $150 a month or more, you're going to be able to afford one of our programs because we can fit this into your budget. In fact, most of our patients here are on single budgets, single family incomes. They're on fixed budgets or retired incomes, and we can usually find a way to work it into their budgets. So if you're really wanting this, you're wanting to get your life and your health back, we'll find a way to make it happen for you, okay? And the last question that I usually get, and I hear it quite a bit, is can you help everyone? Well, obviously not. There is a point of no return, and sometimes it's just beyond that. In fact, one of the first patients that I ever saw when I first started dealing with functional health care was a patient that came and had two different types of autoimmune diseases. She had Hashimoto's and Graves' disease, and she had been to multiple doctors. Nobody had been able to help her. They were just putting on one medication after another. She was just so sick and tired, and she was ready to give up. We worked with her for a few weeks. She started feeling better. She had a few good days, and then she'd have a bad day and then another good day. But then she'd stay home for, I wouldn't see her for a week. And then she'd come back in and said, I just couldn't even get out of bed. I was so sick. And this went on for a while. Finally, her husband came in to visit me and said, the other morning I rolled over in bed and my wife's cold, dead body was laying next to me. But the thing that touched my heart was that he didn't come in to complain or he wasn't upset. He said, I just wanted to thank you because you're the first doctor that ever listened to her and did anything to help her. So there is a point that, no, I can't help those that are so far gone, but if you're willing to try, this is the best shot that you're going to get at getting your health back. Yes, we all have that appointed time that God says, nope, you're coming home. If that's it, I can't do anything about that. But we will do everything in our power to turn things around and get your health and your life back. When I first started getting involved with holistic health care, I went to the different classes and the seminars, and the doctors told me, listen, you can't sell something you don't own. So you need to run these tests on yourself. And I did. I ran all these tests, and it came back, I had an autoimmune disease. It was attacking my pancreas. I was pre-diabetic. The skin condition that I thought that I had was eczema, was actually my immune system attacking my own skin. It was attacking my gut. I had the leaky gut and the leaky brain. As I started to make these corrections, though, my health came back. And the things that I thought that were just normal things of life, like allergies and hemorrhoids and who knows what else, they all resolved. They all went away. Because once you start to get your health and your body functioning, everything starts to fall into place. Now, if you're ready to get off of that road to being fat, sick, and depressed, or possibly even dead, this is your exit. So I hope you'll take us up on this offer. Give us a call, and we'll get these paperworks, the paperworks to you, or get you scheduled for your appointment in here. And I truly wish you from the bottom of my heart the best of health. And God bless you, and thank you for your kind attention in watching this DVD.
I was very discouraged because I know how to eat right. I've been eating organic for a long time, but I still was not experiencing any weight loss, and I wanted to get my weight loss under control. I have a goal that I want it to be, and the older I get, the more I want to be in control of my body.
Well, you see, I thought I was just tired from moving, but I wasn't myself, I knew, because I didn't want to drive much, which isn't like me. So I just didn't have any idea, except my husband finally said to me, I think we need to find out what to do.
I had been trying to do so many things. I've been trying to work out, I've been running, fixing parts of my diet, and I just was not seeing any results, period. I was very minimal results. I was maybe getting a little bit stronger here and there, but I kept retaining the body weight.
Psoriatic arthritis, fibromyalgia, extreme overweight, hormone issues, thyroid issues, not feeling healthy.
Before I came in, I mainly came in because I saw that Dr. Filippini worked with thyroid issues, and that was my main concern. I'd been on medication for 11 years, and my thyroid condition had gotten worse and not better.
I've been on prednisone for a year and a half, along with methotrexate and hormone replacement therapy, antidepressants for years. They had finally started me on a biologic, like Symphony, which is the injections, and I didn't want to take that. I didn't want to drop my immune system down to nothing.
First of all, I'm in tune to my body. I'm excited that I can feel a healing going on within.
So far, the results have been phenomenal.
I guess I didn't mention this earlier too. When the test results all came back, one of the things that flabbergasted me was that my cholesterol was really bad, my triglycerides were really bad, and in fact I was in metabolic syndrome. I was pre-diabetic. And how could that happen when I was under treatment all this time? About 3 months into the treatment program then and making the lifestyle changes, we did some of the blood work again, at least in the areas that were of concern. Out of 57 things that were tested, 15 of mine were flagged as being issues. And the nice thing about that is that aside from my thyroid, still needing some help, all of the other things went to normal. Glucose, triglycerides, cholesterol, iron, sodium, all of those things that had been issues were all normal levels after 3 months.
I've already lost 30 plus pounds. I feel fantastic. My sleep has gotten better. It's been an excellent experience so far. I've just gained a better sense of knowledge on what goes into my body, how my body operates, and what my body's capable of, the healing process of my own body.
I feel like I'm back to being my more upbeat type of person.
Just the first 6 weeks, dropped 12 pounds. In the last 40 days, I've dropped another 28 pounds.
As I was driving here, I realized I am back to who Deanna was. And it was exciting. I just could hardly wait to get here and tell everybody I feel so good.
I have the energy to exercise now. I sleep better. I concentrate better. I have to buy new clothes.